Hello, Dr. Vicki Peterson here. The question I was asked today had to do with testing for gluten sensitivity. And the person asking the question was concerned about how well their doctor was going to be able to interpret the test because this individual had a prior problem with thyroid disease that had been undetected. So he knew he was having a problem, yet it took a while for the lab test to finally be interpreted correctly. He is now concerned about gluten sensitivity being a problem and wants to know what he should be cautious of in the interpretation. It's a very good question, and I'm going to do my best to make this as simple as possible. There are a lot of tests out there. There's, of course, the biopsy, so let's talk about that as far as celiac disease is concerned. The intestinal biopsy that used to be the gold standard for diagnosing celiac disease, no longer, because we realize the limitations of that test because of the sheer size and surface area of the small intestine. Going in and taking a few little snips of it and trying to detect whether there's a problem has a lot of false negatives, and very often people are told they're fine when they are not. And by the time that test shows there's a problem, there's been a problem for a very long period of time, and the person's health is very deteriorated, and certainly something that was more sensitive would have much better served the patient probably a decade prior. So for the moment, we're going to put intestinal biopsies into the not-so-good category. Then we look at blood testing. So we have the endomysial antibodies, that is a blood test, the tissue transglutaminase antibodies that are also a blood test, and that's the standard blood test that's done usually preceding a biopsy, and if those are positive, then a typical gastroenterologist will then do the biopsy to confirm the diagnosis. Once again, both the endomysial and anti-tissue transglutaminase tests are really more apropos for celiac disease. They are positive when there's a tremendous amount of destruction in the small intestine. And really what we're trying to do is find out that a person has a problem before they've totally destroyed their small intestine. That's my goal, anyway, with my patients whenever possible. So once again, waiting for those tests to be positive or doing nothing until those tests are positive is probably waiting too long. So then the next best thing we're looking at are antibodies. So that's basically, there are saliva tests looking for gliadin antibodies as well as blood tests. There's also a stool test. That there's a little controversy associated with that because other agencies have not been able to duplicate the results of Dr. Kenneth Fine through Entero Lab, but I have certainly had patients get positive test results from the stool test, and indeed they were gluten sensitive. So I don't have a problem with it, although there is some lack of corroboration. So I wanted to mention that. Here at the office, we do the saliva and blood both. So we're trying to look at the body from two different directions to make sure we don't miss anything. And the important thing with that is you're basically asking the immune system, how does it feel about gluten? Does it have a reaction to it? So those tests are pretty good. They are highly specific, meaning that you're not going to get a false positive. When they're positive, and you don't have to worry about that being false. The problem with these antibody tests is they're not as sensitive as they need to be. So what that means is, unfortunately, there are a lot of false negatives where the test looks fine when the patient is not. Now, there is a little bit of reading between the lines that can help increase that sensitivity a bit. One is through the saliva testing, it's important that the laboratory provide not only the immunoglobulin result to the antigliadin, but looking at the total, what's called IgA in the specimen. So looking at how strong the salivary immune system is. Because what happens for a lot of gluten-sensitive and celiac patients is that their immunoglobulin A in the saliva and in the mucosal membranes is diminished. It's diminished because they've been eating gluten, and this has created tremendous stress on their immune system. So that immune system is depressed and stressed because of the gluten. So when you're evaluating the test, you need to know how strong a pull you're pulling from. So let me give you a little bit of an example. in our particular lab, if the score is above 20, then it's considered positive, a positive immunoglobulin response to gluten. However, what our lab tells us is that if the total IgA is below a certain number, then you have to take that into consideration. Let's imagine that the total IgA number should be above 100. As an example. So if it's above 100 and the patient is below 20, then you can feel pretty safe in saying it looks like they're not having a reaction. But imagine a patient whose salivary IgA comes back at 50, half the value of what it should be, and then their score for the antibody is 18, as an example, pretty close to that 20. What our lab tells us to do is take that 50, multiply it by 2, which would get you to 100, and do the same thing for the anti-gliadin score. So you would take that 18 and multiply that by 2. That would be 36 and an obvious positive. So I hope without drawing that wasn't too confusing. But in other words, there is some interpretation that needs to occur. So if you're just given the salivary immunoglobulin number as far as reacting to the gluten and not given the total number, you could really miss an appropriate diagnosis. And then last but not least, we always back it up with eliminating gluten from the diet and seeing how the patient does. Minimum 3 to 4 weeks. We like 4 weeks, pretty close to our minimum here. And so we want someone completely off gluten for 4 weeks and see how they do. And that's usually enough time for the person to start feeling improvements. So I hope that was helpful and answered some questions. And until next time, I wish you very good health.